Want to insert an IV cannula like a pro? Here's your quick guide. Step 1. Preparation. Gather your supplies. Sterile IV cannula kit, gloves, antiseptic solution, tourniquet and dressing. Make sure everything is within reach to avoid any interruptions during the procedure. Having a well-organized tray can make the process smoother and more efficient. Step 2. Tour tube. Patient preparation. Explain the procedure, get consent, and position the patient comfortably with the chosen vein visible. It's crucial to communicate clearly with the patient to alleviate any anxiety they might have. Ensure they understand each step and why it's necessary. Step 3. Hand hygiene and gloving. Wash your hands thoroughly and wear sterile gloves to prevent infections. Hand hygiene is the cornerstone of infection control, and wearing gloves adds an extra layer of protection for both you and the patient. Step 4. Tourniquet application. Apply the tourniquet a few inches above the insertion site, snug but not too tight. The tourniquet helps to engorge the vein, making it easier to locate and puncture. Be mindful of the patient's comfort and check for any signs of discomfort. Step 5. Site cleansing. Cleanse with antiseptic in a circular motion, center to outward, and let it dry. This step is vital to minimize the risk of infection. Allowing the antiseptic to dry completely ensures maximum efficacy. Step 6. Stabilize the vein. Apply gentle traction below the insertion site to keep the vein steady. This helps to prevent the vein from rolling and makes the insertion process smoother. Proper stabilization is key to a successful cannulation. Step 7. Cannula selection. Choose the right cannula size based on the patient's condition and therapy needs. The size of the cannula can affect the flow rate and comfort for the patient, so select appropriately. Consider factors like the patient's vein size, the type of fluid or medication, and the duration of therapy. Step 8. Insertion technique. Hold the cannula at a 15 to 30 degree angle, bevel up and insert smoothly. A steady hand and a confident approach can make a significant difference. If you encounter resistance, do not force the cannula, reassess and try again. Step 9. Confirm blood return. Pull back on the syringe plunger to verify blood return, ensuring proper placement. Blood return confirms that the cannula is correctly positioned within the vein. If there's no blood return, the cannula might be in the tissue and you may need to reposition it. Step 10. Secure and dress the site. Apply an adhesive dressing to stabilize the cannula, ensuring it's secure but not too tight. The dressing should keep the cannula in place while allowing for some movement. Check the site regularly for signs of infection or displacement. Step 11. Sharps disposal and documentation. Safely dispose of sharps and document the procedure details. Proper documentation includes noting the time of insertion, the size of the cannula, the site of insertion, and any patient reactions. This information is crucial for ongoing patient care. Mastering IV cannulation is essential. It requires practice, patience, and attention to detail. Each step is important to ensure the safety and comfort of the patient. Follow these steps for a successful and safe procedure. Happy practicing. Thanks for watching.